This interview includes in-depth discussions of serious mental health topics. It covers personality disorders as well as highly sensitive subjects. These topics may be distressing or triggering for some listeners. Listener discretion is strongly advised. If you or someone you know is struggling, please seek support from a qualified professional or contact your local crisis resources immediately. What is an actual narcissist?
What I found with male narcissists that's really interesting is the pattern is they almost always have a mother that thinks they're perfect and a father who thinks they are garbage.
Wow, that's so interesting.
It's fascinating.
I know someone like that.
There's often risky behaviors around maybe sex, drug use, impulsivity, really black and white thinking.
75% of borderline personality disorders are women, but you think it's underdiagnosed.
I think it's overdiagnosed in
You think
women.
it's overdiagnosed in women.
I think it's overdiagnosed in women. I could go on all day about the sexism.
Tell me.
Hi, everyone. It's Mary Alice Haney.
And Dr. Thaïs Aliabadi.
We talk to so many women in our SheMD community who are just done. They're doing the workouts, they're eating the right things, but they're still hitting that 3 p.m. wall, dealing with brain fog and feeling like their body is working against them.
As an OBGYN, I see this every single day. Women are told they're just getting older or they're stressed. But the truth is, your metabolism is your body's master regulator. You don't need another caffeine fix. You need to support the system that powers you.
That's why we created Ovi. We weren't looking for a quick fix or a miracle pill. We wanted a real doctor-formulated solution for complete metabolic care.
We built Ovi to the Ovi standard. No proprietary blends, no fillers, just clinically studied ingredients. It's designed to help your body manage blood sugar spikes and stay in a steady, high energy state all day long.
And it's the easiest part of my morning. No more giant pill organizers, just one simple ritual.
Real metabolic support isn't a quick fix. It's a phased journey. Give your body 90 days to start, feel, and see the sync.
It's time to get your spark back. Head to ovi.com to start your 90-day metabolic reset today. Use code SheMD at checkout to save 10% off your order. That's ovii.com. Your body will thank you. Okay, guys, on today's episode, we are going to help you figure out if you're dating a narcissist or just an asshole. Either way, we think you should probably leave them, but listen up and you're going to be able to figure this out for yourself.
And if you have instability in your mood, if you have self-image issues, if you jump from relationship to relationship, if you have fear of abandonment, or you have impulsive behavior, you might have borderline personality disorder. And there's definitely a treatment for it. So I want you to listen to this podcast.
We actually have Dr. Wallach here, who is a specialist in borderline personality disorders. And I am fascinated by this. I mean, I really think, we throw that term narcissism around like, oh, he's a narcissist. I'm a narcissist. She's a narcissist. But we're going to actually really understand today what is a narcissist. And like I said, sometimes it's hard to tell. Or are they actually a narcissist? So I know this is what you do, every day in your practice. So thank you so much for being here. We're so excited to dive in.
So excited to be here.
Just like Mary Alice said, a lot of us walk around and say so-and-so is a narcissist, this one has borderline disorder, without really knowing what it means. So can we start with the cluster B?
Yes, of course. Where do we begin?
So I want to start because obviously I'm not a psychiatrist and I was reading about this. And when it comes to personality disorders, they divide them into 3 clusters. Cluster A, Cluster B, Cluster C. Cluster A are patients with psychotic feature personality disorder, which we're not going to talk about that. And Cluster B is your specialty. Cluster B is antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder.
Yeah.
And then cluster C, which we might touch on today, these are women or men with avoidant personality disorder, or dependent personality disorder, or obsessive compulsive.
Well, I think let's start with narcissism, since that's the one that gets thrown around so much.
It
Like,
really
what
does.
is an actual narcissist?
So narcissism, It actually does get thrown around a lot, I think, and I think it gets thrown at men. And a really big thing that's trending right now on social media is narcissistic abuse. But really, to qualify for a diagnosis of narcissism, you have to have delusions of grandeur. There are usually um, rages that happen when you poke at a narcissistic wound. The thing about narcissism is it's actually, believe it or not, it's a disorder that comes from a shame that's built from within. So the delusions of grandeur that narcissists have are actually created to cover a shame-based self that really is created usually from a really invalidating childhood. Personality disorders, in particular, the cluster B ones, actually really are just trauma, which is one of the reasons I got so interested in treating them, is because they're so pathologized and they're weaponized. Like when people throw that around, like he's a narcissist, she's borderline. One of the reasons I started treating personality disorders was because I felt that they were so over pathologized by people, and a lot of clinicians refused to treat them. And people misunderstand them. So, narcissists in particular, although they are really hard to treat and can be really unlikable, to be honest, really, I have a lot of empathy for, because they really create this kind of false self around themselves in order to cover up a really painful shame that they feel inside.
And you think it's based on childhood trauma?
Almost 9 times out of 10, it is
Wow.
usually
Okay.
based on childhood trauma. What I found with male narcissists that's really interesting is the pattern is usually that they usually have a mother who is really overbearing and builds them up, and a father who is really shaming or absent. Almost 99% of the time when I treat male narcissists, they almost always have a mother that thinks they're perfect and a father who thinks they are garbage.
Wow, that's
I
so
I
It's
interesting.
know
fascinating.
someone like that.
Well, so you're not born a narcissist then, is what you're saying?
No, personality disorders are not genetic. They're created in a childhood environment where your needs aren't met. And depending on what's going on in the environment around you, you figure out ways to survive, and also what's being modeled for you by your parents, right? So, for a narcissist, if you have one person telling you you're perfect and another person shaming you, it's going to create an inner shame. But if someone else is telling you that you're perfect, it often creates this sort of like motivation to become perfect and create an environment that you can control and that shows the world that you're perfect, but you're still dealing with all the shame inside.
Mm.
So when someone kind of pokes through that exterior of that kind of false self that you've created, you see this rage that can happen where the narcissistic rage comes out. And what's really interesting is that borderlines and narcissists often end up together romantically.
Oh, no.
Oh,
I
yeah, there's a
think
book about it called The Borderline and the Narcissist, and they often end up dating. So in my practice, we see them a lot together for couples therapy.
Well, so what's the difference between the two?
So with borderline, and that's really my passion and what I love the most, borderline just personality disorder is often where you have intense fears of abandonment. There's often risky behaviors around maybe sex, drug use, impulsivity, really black and white thinking. So one day you might be the perfect doctor, and the next day you're the worst doctor on the face of the earth. I'm often the best therapist ever, and then the next week I'm getting fired, and then 3 days later I'm getting an apology and getting, please can I come back? With borderlines, there's often self-harm happening, high levels of suicidality, um, things like that. So they can be they can fly into rages. They can often, like I said, have trouble with impulsivity. So they can often engage in behaviors that can scare people. So Marsha Linehan, who created dialectical behavior therapy, which is what I specialize in, she often described borderline personality as kind of walking around with third-degree burns. So she said it was like lacking an emotional skin. So the way that I describe it to people is sort of like if one of the three of us were talking to someone and they maybe made an offhanded comment that kind of annoyed us, we might just be able to be like, oh, that was kind of annoying, and brush it off. Someone with borderline personality disorder might hear that, and it's a disease of perception. And so their perception might be like, this person really just said something horrible to me. And then they might sit and they might stew and they might start texting that person and they might send, and that person doesn't respond. And then they might send 20 more texts and then that person doesn't respond. And then they might fly into a rage and then call that person. And then they continue to make things worse. And what they're really trying to do is express the fact that they're in pain, but they often do it in a way that goes really sideways. So, what we try to do when we're doing dialectical behavior therapy is teach them how to express their feelings without making the situation worse. But when you combine a borderline and a narcissist,
Trouble.
yeah, because you have one that pulls away and one that chases.
So what are the traits of a narcissist?
So with a narcissist, you often have an inability to attach, right? And with a borderline, you have someone that wants to attach intensely. With a narcissist, you have someone who has delusions of grandeur. With borderlines, you often have someone who feels like they're worth nothing. They often have really like fragile senses of self, and they often conform to fit with whoever they are. So often borderlines, when they're dating people or when they're friends, you'll see them kind of like chameleon into these other people. So if they date someone who's really into golf, they take up golfing, they break up with that person, they make a new best friend, and that best friend is maybe really into art. And so all of a sudden they start studying art all the time. So they kind of, because they have such a fragile self-image and low self-image of themselves, they don't really know who they are. And so when they get together with a narcissist, they can often boost the narcissist's self-esteem. But when the narcissist starts to pull away, then you have this dance that happens, but it inflates the narcissist's ego. And so you have the borderline feels horrible. But then what happens is when the borderline might finally, if she's in therapy or he's in therapy, maybe they have a therapist who's like, hey, this is really unhealthy. You might want to pull away. A narcissist cannot tolerate being ignored or being pulled away from. So if you finally have a person who's borderline who maybe might try to start setting boundaries, then you have this dance. The narcissist can't tolerate being ignored and they come back. So you constantly have this dance going on that I've seen go on at times for years. For years.
For years.
Wow.
As you're talking, I think of these couples I've met throughout my life.
Yes.
And I'm like, right. So how do you tell the difference between borderline personality disorder and dependent personality disorder? Because I always thought dependents also get into relationships with more dominant men, let's say.
Dependent personality disorder is really an inability to make any decisions without
Someone else.
someone else. So someone with dependent personality disorder is really unable to like pick out a coffee table or figure out which grocery store to go to. I mean, it's really a dependency. Like they cannot, decisions paralyze them. So someone with borderline personality disorder is able to go to a furniture store and pick out
I
their stuff.
see.
Somebody with dependent personality disorder is almost like a child. So they're dependent on everyone around them. They almost cannot take care of themselves or make decisions without becoming totally paralyzed.
And do you think in cluster B, the borderline personality disorder patients are more at risk of suicide?
Definitely. They have a very high risk of
Very
suicide.
high, right?
Yes, very high risk
I
of
didn't
suicide.
realize it was that high.
And very high levels of self-harm with cutting and burning and things like that.
I
What-
heard 75% self-harm, 10% attempt suicide.
10% attempt suicide, and I
Isn't
think
that crazy?
3 to 5% die by suicide.
And
And-
it looks like from the stats, 75% of borderline personality disorders are women. But you think it's underdiagnosed.
I think it's overdiagnosed in
You think
women.
it's overdiagnosed in women.
I think it's overdiagnosed in women. I could go on all day about the sexism.
Tell me.
I think it gets overdiagnosed in women because I think what often happens is I think that women show their emotions more outwardly than men. And I often think that women might end up in front of a male psychiatrist and they're being emotional and maybe they're going through something and they get diagnosed with BPD. And often they end up in my office and I'm like, you don't have borderline personality disorder. You're going through a divorce and like you're appropriately
It's okay to be,
upset.
yes.
Yeah, there's
Yeah,
appropriate anxiety. I think that we
right.
live in a society where we think, oh, depression, anxiety in any level is bad, and
Right.
we want to live these happy go lucky, and that's just not real. That's not
Right. Or
life.
even suicidal ideation. That doesn't mean you have borderline personality disorder. I mean, I think I've had clients, if they're going through a breakup or a breakup after 8 years, or their marriage is falling apart and they're in so much pain they want to die, that's very different than actually being acutely suicidal and having the means, motive, and intent to commit suicide. And so if someone goes to a psychiatrist or another therapist and says, I'm having suicidal ideation, they can automatically, especially women, get hit with a BPD diagnosis. And I can't tell you how many calls I get where it makes me feel horrible, where people say, I went to go see this person and they told me they can't treat me because I have borderline personality disorder and I need to go see you. Because it's so over pathologized that most therapists refuse to treat borderline personality
Why?
disorder.
Why?
Because I mean, they can be difficult clients, they can be abrasive and they can be prickly and they can be at times litigious and they can threaten you and they can be
Fire you
abusive
every
and they
48
can fire
hours.
you. And in dialectical behavior therapy, we're on call 24/7 for them because we do what's called skills coaching. So anytime they're in a crisis, they can reach out, even if it's 3 a.m. My phone is on 24/7. And because the hypothesis behind it when Linehan invented dialectical behavior therapy was that when someone who is emotionally dysregulated is in crisis, they need to be able to reach their therapist in the moment. They can't leave a message and
Mhm.
wait 24 hours for someone to call them back or 5 days for their next session. They need someone to help them before they blow up their life.
Mm.
So that's what we offer in my clinic. And to be really honest, it's only happened a couple times in 12 years that someone's called me in the middle of the night. But if someone is suicidal, I want them to call me.
Yeah.
I mean, usually I'm going to call 911 and stay on the phone with them after that. But if someone is, a 16-year-old and they're at school and they have a calculus test that they don't want to go to and their urge is to get in their car and drive away, I want them to be able to call us so that we can coach them to go into their calculus test. And that might not be a borderline, right? Because teenagers can't be diagnosed with borderline personality disorder. But we treat a lot of teens with DBT that have anxiety disorders and depression and things like that. So they get coaching too.
Suicidal ideation versus suicidal thoughts and planning.
Mhm.
I'm somebody that's never had a suicidal thought in my life. Like and I have anxiety and I have all these things. That is never, and I think if I had that thought, that would make me very scared. And I think that
Sure.
we're living in a society now with social media and all that where it's a lot more prevalent online. People are talking about suicide and this and that, and where it wasn't in my generation, like you never talked about that.
Mhm.
How do you know whether you should be worried about yourself or a child, whether it's an ideation, which is the thought coming in, or an actual, child or yourself or your spouse that's thinking about suicide?
Well, I think you always have to be worried when someone has suicidal ideation, right? You always have to take it seriously. The clients that unfortunately we've worked with that have completed suicide have always been the quieter ones.
Mhm.
So those are the ones that I worry about. The ones that are really loud about it, like I'm going to kill myself, those are not the ones that I worry about. The squeaky wheels, I call them, are
Mhm.
usually not the ones that I worry about. The ones that I worry about are the ones who you just said, if you had a suicidal thought, it would scare you, right? That would feel the same way for me. Like if I had a thought of killing myself, that would be really
Jarring.
jarring for me, right? It's called ego dystonic. Ego dystonic means it wouldn't sit well with you. When it starts to worry me is when people get a sense of peacefulness when they think about
Mhm.
suicide. When it starts to feel like people would be better off, or why won't anyone just let me go? Like, why won't anyone just let me die? When I start to hear things like that, that's when I get worried. And
Mhm.
anytime I hear it in a minor, we take it very, very seriously. Especially, and then when we're assessing, do they have means? So if someone has a gun in the house, we're automatically asking if they'll take their gun to the police station. If someone is hoarding pills, things like that. So we always assess for means, motive. Do you have a plan? Most of the time, the clients we treat some of them have had multiple suicide attempts. That's always a higher indication that they will attempt again. A lot of them, when we ask in our initial assessment that we do, we always ask, are you in so much pain that you want to die? Or do you actually want to kill yourself? And I would say like 85% of the time, people just say, I'm in so much pain, I just wish I was dead.
Right. It's sitting with that feeling that whatever
I
that
can't
is,
take it
rather
anymore.
than
Why am I
right.
here? I'm in
Right.
so much pain. Why am I here? And oftentimes it's just because they haven't gotten the right treatment, or they've been bounced around. They've been fired by their therapist because they were mean to them, or they yelled at their therapist, or they've been in treatment centers where they were told they were getting DBT, but they just were getting a DBT skills group and a lot of other treatment that wasn't effective for them. So a lot of times when they get to us, which, humble brag, I think they get better.
I don't even know how you deal with it. I'm serious. I had one patient years ago who came to my office from her primary care office in Beverly Hills. And when she came to me, she was so, she was crying. And I said, is everything okay? I was very close with her. And she started telling me that she had just left the primary care's office and she had made a plan to go upstairs in the building because there's a back door that would go to the rooftop, and that she was planning to jump off the building. But as she was leaving the office, someone calls her, someone sees her in the hallway, and she gets distracted. So she got in her car and came to my office. So you can imagine, it affected me for weeks. I had to call her psychiatrist. I took her car keys away and I sent her because I didn't know what else to do. She had been to the emergency room. I don't know, why we call 911. These patients go to the emergency room, 50 hold, and then 72 hours later, they're released. So what I did this time, I called the psychiatrist, put her in a car, and sent her to ketamine clinic because I didn't know what else to do. And it worked.
Ketamine's a miracle.
It worked.
So you think that's a great treatment for
how many times are you going to
people.
send someone to the emergency room? I grabbed her keys. I put one of my staff in the car with her, sent her to ketamine. And they literally grabbed her from the parking lot. And she felt so much better, much better, life-changing.
Yeah.
But it affected me for weeks. So, and my staff, literally. So I don't know how you guys do it day in and day out.
I love it.
It's amazing,
I really
but
do.
it's sad.
Well, it's your life calling. You are changing lives. I mean,
Saving
literally,
lives.
You're saving lives every day.
And I think the thing is I really love people with BPD because, yes, there is this side to them that is, a little gnarly. There's this other side of them, though, that because they feel emotions so intensely, they also feel happiness really intensely. They're intensely loyal. They feel joy really intensely. And when they start to get better, it's so rewarding to watch them create a life worth living and watch them go from being acutely suicidal to becoming a therapist, or, going back to college, or like finding a healthy relationship and getting married and having children. And we get to go on this journey with them and watch them heal.
Wow.
And it's just really amazing. And I think it's really a privilege because so many people miss out by not working with them. And yeah, I think if you asked my husband, he would tell you it drives him crazy because he's always like, put your phone down.
That's me too.
Yeah.
That's Dr. A too.
Put your phone down. Yeah. I work with a lot of people that need me a lot. So, but it also is so rewarding. And I think it's such a privilege because there's this other side to them that's so amazing. And they're really, like I said, just so misunderstood.
Can I ask you a question?
Yeah.
If 9 out of 10 of people in the cluster B with, antisocial personality disorder, borderline, histrionic, and narcissistic, if 9 out of 10 have a history of trauma, then that would be the first thing you address, right? In therapy, or no?
Not in DBT.
Really?
No. So Marsha Linehan, who is our like our savior in DBT, we call her Mother Marsha. She developed DBT in 1989. She had borderline personality herself. And after being institutionalized for 4 years, there's a wonderful article in the New York Times about her if anyone Googles it. She went to an ashram in India for, I think, a year. And then she came out of it and she said, I'm going to get my PhD in psychology and invent a treatment based on everything that I think my doctors did wrong. And so she got her PhD in clinical psychology. And she really liked CBT, but what she didn't like about it was that CBT tells you to change your thoughts and that your behavior would follow.
Explain what CBT is for our listeners.
Cognitive behavioral therapy. And the hypothesis of CBT is that if you change your thoughts, your behaviors will follow. And Marsha Linehan thought, I can't change my thoughts. Like, I have no control over what comes into my brain when I enter a room. If I think, oh, I don't like the floors, or, oh, I don't like that person over there. Like, I can't control that. There's sensations of my brain. So she came up with a model of CBT, which she changed to DBT, which hypothesizes that while we can't control the thoughts that enter our brain, we can control how we react to them. So what dialectical behavior therapy consists of is individual therapy sessions. Once a week, the client attends a group skills class where we teach them DBT skills in 4 areas, which are mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. They have access to 24/7 skills coaching.
What are those 4 things? Can you explain it?
So mindfulness in DBT is not like Zen mindfulness or meditation. It's mindfulness of what's happening in your body and the environment around you. So if I'm mindful that I'm having a conversation with my husband and I'm starting to get angry, I have the ability to stop the conversation and say, hey, I'm noticing that I'm getting really angry right now, and I think we should stop.
Unhealthy.
Yeah, and come back to this like in 10 minutes, which I often do several times a week.
I need to do that.
You need to do that?
Yes, I need to do that with not just my husband, with everybody. I go from 0 to 1,000 in like 2 seconds flat. I need to put myself in a
And
timeout.
he's always like, stop using your DBT skills with me.
That's funny.
So mindfulness in DBT is just being aware of what's happening in my body and what's happening in the environment around me. So also, am I in an environment that's activating me? Is there a person here I don't like? Am I afraid of doctor's offices? And am I in a doctor's office? Like, what do I need to do? Emotion regulation are tools to regulate your emotions. So self-care. We teach what are called please skills. So like physical vulnerabilities. Have you eaten? Are you ill? Do you need sleep? Right? Sleep is a huge one. I had a week of insomnia a couple weeks ago, and I have a new empathy for people that
Yeah.
can't sleep. I
Or
really
want to sleep and they don't get to sleep.
or want to sleep and they don't get to sleep, right? Are you taking mood altering drugs? Because that will affect how you're, interacting with your environment. Distress tolerance is, can you tolerate distress, which is a really big thing with people who have borderline personality disorder. If someone is making you angry, or you feel like someone is behaving in a way you don't like, can you tolerate it without lashing out? That's really important. If you're right, you can't go to work, and if your boss gives you criticism, you can't tell them to F off, or you can't walk out and slam the door. You'll get fired. You have to have these skills to survive in the world. And then interpersonal effectiveness is just that. How do we behave in a way so that we can get what we want from people, have effective relationships, and have lasting relationships? And that's also how to argue effectively, right? How do we argue with people and remember that we care about them, and not, just like destroy people when we're arguing with them, and like scorch the earth
Mhm.
and destroy relationships. So that's what we're teaching people in those groups. And we're teaching them concrete skills that are actually really remedial. They're skills I teach my 6-year-old and probably that you've taught
That's
your
what
kids.
literally, as you're talking, I'm like, these are the things I try to teach my child when they're little. Emotion regulation, how do you navigate the world when you're told no? We teach all of this to our children when they're little, but
these are people who didn't get that in their environments, right? They grew up maybe with parents who were violent, or parents who fought, or parents who maybe criticized them all the time and were like, why can't you be more like your sister? She's perfect and look at you. Or, an invalidating environment could have been even just at school where they were bullied. And so these are people who didn't have their feelings or who they were mirrored or validated for them. So they never learned how to self-soothe or how to manage their feelings. And so as they carried that into adulthood, they don't know how to manage relationships and they don't know how to manage distress. And so they become very ineffective. I'm sure you've seen it. You've raised kids, you've seen their friends, right? They all have different levels of emotional resilience.
as a mother, how do you make sure you're not raising a narcissist?
You validate and you mirror your child and you make time for them. So if your child is having an emotion, you have curiosity about it, you normalize it, you don't shame them, and you mirror them. And I think validating and being curious about your child's emotions is the most important thing. Like with my daughter, Lila Ray, I'm always like, you're sad. Are you sad? And if she's not, I ask her to explain her feelings to me. And even if I don't agree with them, I give her the space to have them. My number one goal with her is that she doesn't end up in DBT.
You know
So-
what? What the problem is, we don't go to school to raise children, right?
No, somebody needs to create a school for parenting.
I mean, 3 nights ago, my daughters were sitting, and I don't know, I said some random thing about some random child who got a perfect score on the ACT. And my kids were like, Mom, stop always comparing us. I wasn't even comparing. But, sometimes they tell me something and I'm like, oh. And then my other daughter was like, yeah, Mommy, sometimes you do that. Sometimes you compare, I don't mean it that way, but I guess now I'm more careful and aware, but we really all need to go to school to raise children.
I agree.
It's the toughest job on the planet.
It is the
is.
toughest
And
job.
you said something, another question about that is, we are living in a praise parenting style where
Yes.
it's over praise. Everybody gets a trophy. Everybody, so how do you sort of navigate that fine line between wanting to love and nurture and praise in a good way and just being like what you were saying, that usually that child has a parent that is telling they're the baby Jesus, and then another one telling them that they're garbage. So how do you navigate that praise sort of mentality?
So I think with children, it's you validate the feelings and then you push for behavior change. So I understand that you're angry and you can't talk to me that way. I understand that you don't like what Mommy just did and you can't hit me or throw things at me. And there's still consequences, right? We don't do timeouts in my house because it's too shaming. But we will do you have to sit for 2 minutes and think about what you did, maybe just on the kitchen floor while I'm doing dinner.
That's my timeout too, except that I say you're in timeout. I'm not supposed to do that.
In DBT for children, we don't use the word timeout. We just say you have to sit
good to
right where
know.
you are and you have to think about what you said. And it's really interesting. She'll just start cry. I always feel so much guilt because she starts crying. But so that's sort of what we do. And then there still have to be consequences for things. I don't know what things are going to be like when she gets older. I mean, you've raised 4 girls, so I'm terrified. Because she's in first
one
grade.
thing I always did with my girls, and now that I listen to you guys, I'm like, maybe I shouldn't have. I have this habit of, I say to my friends, I say to Mary Alice every time I see her, I'm like, you look beautiful today. You look gorgeous. I love the dress you're wearing. I do that with you every time.
Because
it's just
I am,
to have,
and-
I know,
and
but
it is.
sometimes I'm like, I don't want my daughters to think that they need to be surrounded with people who constantly compliment them, because I do that. I do that nonstop with my friends, with my family, with my patients. When I walk in, I always find something positive about someone.
I think
And
that's nice.
It just makes you a nice person.
Yeah.
I know. No. But with your patients and like Mary Alice, it's different. But is it healthy to do that with your children?
Yes, I think it's really healthy to praise
Really?
your
Okay,
children.
good to know.
Yes.
Yeah, but that's what I'm saying. It's how do we know if it's
When
like
is enough?
it like when's enough?
But I also think like you've disciplined your children.
Oh, of course.
So
Yeah.
so then you're saying these are the parents that never discipline, that tells
Never
them that
discipline
they are
their children. My child is perfect. My child can do no wrong.
okay. That's
right.
what you're saying.
That's really different.
Okay,
Yeah. There's a balance. Like, I tell my daughter every day before school, like, you are kind, you are smart, you are beautiful, you are loved, go be
Mhm.
kind to everyone today. But she also has consequences and she
Yeah,
gets in trouble
okay.
sometimes.
Okay, good.
Yeah.
Lord, it's hard to raise children.
It
It's so
is.
hard. And that's the one thing God, we know that we're causing trauma in some way sometimes. And you're doing it. And you hear yourself. Like you actually hear yourself. And you shouldn't be saying that. And then it comes out of your. But I guess the things, I had an amazing parenting expert tell me one time, said the most important thing that you can do as a parent is be able to say that you're sorry, that you made a mistake,
Yes.
and that, you know what,
I do that all
I'm
the
not
time.
perfect.
Yeah. I was
You know,
wrong.
Yeah, I was wrong. So,
And I think it's the power of nurture. And I've seen it with my little daughter who's
Mhm.
adopted. It's life-changing. All you need is love.
Yeah.
If you love them, don't disrespect them, don't yell at them, don't scream at them, and have an environment that's completely calm. There's no yelling or screaming. I promise you that the children heal.
Mhm.
And it's never too late to start.
What do you do when you have a child that comes in from divorced parents and one parent is, a shaming, screaming,
Yeah.
disaster, and then the other parent is obviously not perfect but nurturing? How do you deal with that with
That
that
happens a
child?
lot. Right now we have a case where we have the parents in separate parent skill sessions because in our adolescent program, the parents also have to be in skills.
Oh.
So the parents, because teenagers can't apply or use or learn skills in a vacuum, right? The parents have to understand what they're learning so that the kids can apply the skills at home. So in our adolescent program, the parents have to come once a week and also learn the
Good.
skills.
That's amazing.
Yeah. Yeah. So if we have a parent or divorced parents where maybe they don't get along or one parent is more difficult, we might separate them and have one parent have them with different therapists. And parents get access to 24/7 coaching too, so that if their teenager is having an out of control episode, they can call us and say, like, or she ran away and we can't find her anywhere and she turned off her location. What do we do? Or, she's threatening to kill herself and she locked herself in her room. What do we do right now?
So scary.
I know. God, it's so scary. Well, and that's what my thought is as I'm listening to this. We all have some of this. We all have some elements of all of these things that you're saying.
Right.
So how do you diagnose somebody from just being, you've had some childhood trauma, maybe you're anxious right now, maybe you're like, how do you diagnose somebody with a borderline personality disorder?
So I've now gotten to the point where like I can tell in 5 minutes.
Now I'm really learning, like, I want to know how you really tell. How do you tell if somebody is an actual narcissist or
I mean, a sociopathy, and there really are a lot of, there's sociopaths out there, right? They're not all serial killers. They've learned how to blend. They can mimic, how regular people act. They often experience their friendships as more transactional and they engage in them just not to be bored, kind of, but they don't really experience empathy or remorse. And they can have like fantasies of destroying people socially or sometimes homicidal fantasies or things like that. And it really isn't treatable except through consequences. So,
Wow.
yeah.
Yeah, here it says disregard for rules and laws,
Mhm.
deceitfulness, impulsive, aggressive. They have lack of remorse, and they exploit others.
Yeah.
Oh my God.
and so with all of these, somebody comes into your office,
Yeah.
you diagnose them. So how do you or does it even matter if you have does DBT help all of it? Does it matter if you have one versus the other, or can it?
Yeah. I mean, so I think everyone in the world should be doing DBT. I use DBT all day, every day. It's really funny. My old clinical director who used to work for me and I used to always say, you can't be a DBT therapist unless you're living your life using DBT. You kind of have to really buy into it because you can't teach the skills and teach DBT unless you really believe in it. So I think it helps everyone, but not everyone needs the full program, right? So we do have clients that come in and I'll say, I don't think you need to do this 6-month intensive program with group and individual sessions, but we can do talk therapy where I can weave in, or one of my therapists can weave in DBT interventions where we can kind of teach you skills on the fly. Like I was doing a session the other day and I was talking to this person about, well, wait, why don't we check the facts around this story you're making up about such and such? And, check the facts is just that, because there were all these assumptions this client was making. So let's stop. Like nothing that you're saying right now is a fact. This is all worry thoughts. And let's talk about what the facts are. Here's a fact. Here's a fact. Here's a fact. Nothing you're saying is based in evidence. Like these are all worry thoughts that you're having. So when someone comes in, if they're needing the comprehensive program, what I'm really looking for is not the diagnostic criteria for borderline personality disorder. Yes, that might be one thing. It's more about, are they going to need in-between session contact? So is this person in so much distress that they're going to need us during the week in between sessions? So if this person is going to be texting me 20 times, then they need to be in comprehensive DBT, because if they're in my private practice, they don't have access to that. So that's really what I'm kind of evaluating is like, did their last therapist fire them because they were texting them 100 times or calling them so much between sessions? Or do they seem like they're in so much distress that they're needing skills coaching? And we do have like anyone that is self-harming, anyone that is having suicidal ideation or has had a suicide attempt within the past 12 months has to do our comprehensive DBT program.
I have a question though. I keep going back to the trauma. As a gynecologist, I always thought, when someone tells me, I screen for that all the time as part of my well woman exam. And I always ask about childhood trauma, especially when I see an anxious person. Obviously, I don't know how to diagnose different personality disorders.
That's me. I'm anxious.
But I look for anxiety. I look for mood disorders, personality, anger. But I always thought if cluster B starts with trauma, why not address their trauma? So my question to you is, if you have someone who's suicidal, who's been diagnosed with borderline personality disorder, would you refer that patient to either ketamine, and someday when MDMA or psilocybin becomes available and is legal, would you treat these patients with these medicines as, just to deal with that underlying trauma, in addition to all these other things?
Yeah. So the short answer is yes. So I went off on a tangent about DBT. So in DBT, what we address first is life-threatening behaviors. So if someone is suicidal or having suicidal ideation, doing trauma work is a very bad idea, because trauma work can often make you worse before it makes you better. So a lot of times what happens in normal therapy, and I used to do psychodynamic work and trauma work before I got trained in DBT, is you jump into trauma work with someone, and if they don't have a foundation of distress tolerance and emotion regulation skills, and they're suicidal and they get worse, you can end up with somebody that attempts suicide. So in DBT, what we do is we want to get you a foundation of emotion regulation and distress skills. And after you have that, we will move into emotional experiencing and trauma work. And from the beginning, we always are referring out to, Dr. Stacy Cohen, who you know very well, is somebody. Yeah, I work very closely with her, and we share a lot of clients. And yes, ketamine. I'm a huge believer in ketamine. I have seen ketamine work miracles.
But you're saying what you would probably recommend is to have them,
First.
get emotion
Well,
regularity
before trauma work. And usually what we'll do is we'll immediately refer them to a psychiatrist and let the psychiatrist. So let's say if I referred them to Dr. Cohen, I would let her make that decision if she wanted to treat them with ketamine or she
Yeah,
wanted to
that's
treat
what
them
I
with
did. I mean, they
meds.
had a
Right.
psychiatrist at
Right.
this ketamine clinic.
Right.
Yeah.
Well,
but
so,
it's
and
interesting.
that's a great point. So with this, somebody has a borderline personality disorder. Medication can also help or no?
Yes, absolutely. Medication
That
can
was my
help.
next question. Yeah.
What medications have you seen to help, or does it depend on the person?
So, I mean, first of all, I'm not a doctor, so I want to just say
well,
that.
you're a therapist.
I have a doctorate in clinical psychology, but I'm not a medical doctor.
Yes.
So I'm talking about medications is out of my scope of competence. But what I've seen help is mood stabilizers.
Okay.
And SSRIs help. And then when our clients are acutely depressed and suicidal, I have seen ketamine change people's lives. I mean, one session.
Yes, that's why. I mean, I've seen it with my own eyes.
Yeah, and I think with ketamine, when you're doing it with a provider who's trained in it, who also knows how to talk to you when you're under the influence of the ketamine
Right.
and talk to you about the trauma in conjunction with going to therapy, the results are just really amazing.
Especially, isn't it true that once they have their ketamine treatment and they go home, you send them home, that's when they start processing.
Mhm.
And it's important to have access to someone, a professional therapist or psychiatrist during that processing.
Mhm.
Some people do well with that, but some people really need some hand holding.
Yeah.
And I don't think people realize that.
Yeah. Yeah.
Well, it's like anything. You need to go to an expert and a professional.
Yes.
Ketamine can kill you like it did with Matthew Perry, or
Right.
it can save you like it did with your patient. I mean, there's just it's all in who's providing the treatment.
Right. You need to go see a doctor that
Yes,
specializes. Yes.
And I can tell you of the hundreds that I've referred, maybe 3 came back and said, it didn't really work. It has like no risks. And
Well-
it's life change. It's very safe. If
Right.
not when it's done
right,
as a street drug.
right,
I'm
right,
saying
right.
with a professional,
Yeah.
like if you go to a clinic, ketamine clinic, if you have a psychiatrist giving it to you, the risk of it is I've never seen a complication in hundreds of patients that I've referred.
And that's why you need a responsible doctor, because like a
Exactly.
responsible doctor wouldn't be giving someone with the kind of history or somebody with substance use disorder ketamine normally.
Our listeners right now, or our viewers, depending on where they're watching or listening to the podcast, they're hearing this conversation and they either have someone in their life or them. How do they know that they have borderline personality disorder or narcissism? Or like, how do they, like, what are the diagnostic criteria?
So, I mean, a narcissist is never going to self-diagnose as a narcissist. That's number one. So no one that is a narcissist will ever be like, even if they read the diagnostic criteria, they will never say, yes, I have this. Usually what happens with narcissists is that they will end up losing so many relationships that hopefully they will get to therapy and they will end up with a gentle and tolerant enough therapist that they can eventually tolerate being told, and they won't leave therapy. But they don't often end up in therapy, and they often can't tolerate it. They're very hard to treat.
Are they angry? Do they have anger issues?
They have anger issues because of the shame. So like I said, sometimes they can be fun. Like I've treated a couple of them that are, because they can be charming, right? So there's the narcissist that can be really charming and really engaging, right? I always think of, it's a bad example, but I think of Ted Bundy, right? Like, he volunteered at a rape crisis center and walked women to their cars and warned them, like, be really careful, there's a serial killer out there, right? He had this very charming side to him, and that's how he was able to lure, women. And he was a malignant narcissist and sociopath. And then there's these narcissists that are very angry and kind of off-putting. Like you get in a room with them and you're kind of like, you
Tense.
can feel it. You're just like, ick.
But again, how do you know they're just not an asshole? Like, that's what I'm trying to understand is how
But
can you—
assholes are narcissists. I'm just
The
saying.
delusions of grandeur, right? So
okay. They see
They see
delusions of
themselves above
yeah,
everyone.
right, yeah, like a sense of being above everyone.
Okay.
Are they knocking you down all the time?
Okay.
Are they right? Like is the person, and oftentimes like right, I mean, I think we live in LA, so I work with a lot of people that that need a higher level of discretion and things like that. And so I think a lot of times when people are in the entertainment industry and things like that, that can contribute to those things, right? Because you really are living a grand life and things like that. But how do you know if you're dating a narcissist? I mean, if someone, first of all, you shouldn't be dating an asshole or a narcissist. That's
Exactly.
number one.
Yeah.
So if someone's an asshole to you, break up with them. And if they're a narcissist, I mean, and they're abusing you, narcissistic abuse is also a lot of gaslighting,
Mhm.
a lot of like, you're not doing that right. You could do it better. I didn't say that.
Mhm.
This is about you, not me. A lot of like not being able to take accountability for things, not being able to own things. They often refuse to go to couples therapy. They won't do therapy at all. And how do you know if you're borderline? I think if you're experiencing intense mood swings, if you have a pattern of unstable relationships, like you can't hold friendships, you're fighting with people all the time, you're engaging in high risk sex or driving your car really fast, you're using drugs or abusing alcohol, your thinking is really black and white, you find yourself, feeling really lonely, like not having a stable sense of self, really like chronic feelings of emptiness. Um, People with BPD, I think, often also can get mistaken for, they often get mislabeled with bipolar too.
I was about to tell you, this sounds bipolar.
Yeah, I get a lot of that where they'll come in and say, like, I was diagnosed with bipolar 2.
And explain bipolar.
So bipolar 2 is different than bipolar. So that's also another one that's really misused when people are like, oh, that person's bipolar. And I'm like, I don't think you know what that means.
You're just throwing these terms around and you have no idea.
I
what
know.
you're
I'm
talking
like,
about.
just because somebody is angry and then not angry, that doesn't mean they're bipolar. So bipolar 1 is when you see like episodes of mania and then intense depression. And it also means that you have to have been hospitalized at least once for an episode of mania. Bipolar 2 is more where you see hypomania, which is like lower levels of mania.
And
So-
explain what that is.
So maybe like not sleeping for maybe a day, or like you see somebody that's like cleaning their apartment or doing projects all the time and they're getting like really creative but they're not like going to Vegas and betting all their savings on like, a roulette table, right? It's not crazy. They're not destroying their lives. And then lower levels of depression where they're not getting suicidal, but it shows up as like irritability and like kind of like a dysthymia, right? Just like a low level depression. So it's instead of this, it's more like
Little
kind of like
waves.
little waves. And so
And that's called bipolar 2
bipolar 2.
or hypomania.
Yeah.
Okay.
Yeah. So, well, the hypomania is the
Is-
high part,
is
right?
the high
It's
part.
the high part.
Okay.
So oftentimes with people who have borderline personality disorder, they'll go to a maybe psychiatrist that's not as savvy as like say some other psychiatrists, and they'll get misdiagnosed with bipolar 2. And so yeah, they'll come into my office and I'll sit and I'll talk to them and they'll say they have a diagnosis of bipolar 2, and then I'll start asking about their childhood and asking about the pattern of their relationships and what's been going on, and then lo and behold, no, you don't have bipolar 2. You have
So
borderline.
can we say that with bipolar, you don't need to have childhood trauma, right?
Correct. It's genetic.
But with borderline personality disorder, 9 out of 10, these patients have trauma.
Yeah, it's
Okay.
developed. It's your personality.
Got it.
Yeah.
That's amazing. See, I didn't know any of this. I love
I told
this.
you this is so good.
I know. I love it. The other thing that I think is so incredible about DBT, when I learned about it, I don't know that much about it, but and I would love you to say a few of these for our listeners so they can understand really a little bit more. But one of the tips is, I think it if you have anxiety or you're having a intrusive thought or whatever that is, get a bucket of ice
Oh, the TIPP Skill.
and just put your face in it, or get into a cold plunge, or like you're shocking your nervous system out of this.
Snap out of it.
Snaps. Can you talk about that a little bit?
Yeah, so that one is the TIPP Skill, and so it's TIPP. So you're talking about temperature. So that's the T in the TIPP Skill. And getting a big bowl. I actually have a client, I love this. She bought herself a big fancy bowl for when she does this so that she can have like an aesthetically pleasing experience when she does TIPP. I love her for that. And you fill it up with ice water, and you have to put it below you, and you bend over. And the most important part is that the mask part of your face, your eyes and your forehead have to go, and you plunge into it for 30 seconds. You come up and you do paced breathing, which is like 6 in and 8 out for 2 minutes. And then you plunge again for 30 seconds, and you do that 5 times. The neuroscience behind it is that it imitates, it tricks your brain into thinking you're diving into cold water, which slows down your blood pressure, slows down your heartbeat, also keeps you from thinking about whatever you were panicking about, and immediately lowers distress.
And this is for panic attack?
Panic attacks, anytime. So in DBT, what we immediately ask people when they're panicking or when they're in distress is, what is your level of distress, 0 to 10? And if anyone is an 8, 9, or a 10, that is when we will say use TIPP. So I have a client that lives on the beach, and she will sometimes go jump into the ocean. Or I have another client who once just dove into her pool in the middle of winter. But we also have clients all the time, and they're like, oh my gosh, please don't make me go duck my face in ice water. And I'm like, I'm sorry, go do 5
Go do
rounds of
it.
TIPP.
Does a cold plunge, not putting your face in, getting into a cold plunge, does that do the
Getting
same thing?
into a cold plunge can work too, but really like you have to imitate diving into water. So it's the bending over part that works, but shocking your system in cold water will work too.
So that's T for temperature. What's the rest?
Temperature, intense exercise. So we might tell people like, go get on a treadmill just for 10 minutes, or even like go out into your parking lot and run sprints. Or, intense exercise for 10 minutes, get your brain to like secrete dopamine and endorphins. Paced breathing, and then paired muscle relaxation, which is where you tense all your muscles for like 15 seconds and release. It gets your muscles to release chemicals that relax you.
My daughter does that with me every night.
She does.
So maybe she's listening to you, or I don't know. She's like, Mommy, tense up, tense
And you just, any of those that work for you, or are specific ones for different things?
You can use them all together, or it depends on the client. So for me, like the progressive muscle relaxation doesn't work. So I usually do TIPP with paced breathing.
What's paced breathing?
So that's where I said like it's like the yoga breathing. So 6 in, 8 out.
Yeah.
Some clients will do 4 in, 6 out. It depends on the client that I'm working with. Like some clients absolutely refuse to dunk their head in cold water. And I'm like, okay, if you won't do it, then just do paced breathing. Or like if someone's really distressed, I'll say do a wall sit. Because like if you're doing a wall sit, you cannot think about anything besides the fact that you're doing a wall sit.
Because your legs are hurting.
Because your legs are hurting.
I love that. To me, that's like practical. I mean, anybody can do that.
And the point is we want to get your prefrontal cortex back online, right? Because your amygdala is firing when you're in distress and you're in fight or flight. So we want to start problem solving. So usually I'll say, go do that, call me back. Where's your distress level now? I'm at a 6. Okay, now we can work on emotion regulation. Right. And now we can problem solve. So like now we can talk about the fight with your boyfriend and how we can problem solve. We cannot problem solve while you're having a panic attack. And that's what a lot of times emotionally dysregulated people do is they're panicking or they're angry and they're at a 10 and they don't stop to realize that their brains aren't working and that they're having a trauma response or that their prefrontal cortex and their rational thinking has just shut down.
Isn't that crazy? I mean, this all makes so much sense. When you have a toddler that's having a massive tantrum, you can't talk to that toddler.
No, you just sit
there's
down
no
with
reasoning
them.
with that toddler. That toddler has to calm down. You can hold them, until they calm down, and then you can have the conversation. And, and you know what I mean? It's the same thing. It's just that we forget these things as we get older.
And you know how when we started, you're like, how do you know if you're dating a narcissist or an asshole? The way I look at people, whenever, and I always say this to my children, if someone is an asshole, he probably had a rough childhood.
Yeah, I say
It's
that
so
too.
easy for us to
I
walk
say
around.
the
Maybe
same
it's
thing.
like the doctor in me, but in medicine, they always say when you have a patient who comes in and she's angry and she's yelling at you, has nothing to do with you. You know, you have to separate yourself and see why they're yelling or screaming and not feeling well. And
The same
for
with the
me,
bully.
yeah, for me, I always remind myself of that and my children. I've taught them right now that if someone's lashing out, if someone's mean, if someone's screaming, they're the ones hurting. You should actually feel bad for them. So if you're dating an asshole, yeah, you don't deserve it. But you also have to know you're dealing with someone who's probably has had childhood trauma, has had a rough life,
Most of the
and
time.
just that's how they're projecting, they're expressing themselves. So if you understand that, then you won't get angry. It's like, you know, if your grandpa has dementia, you don't yell at them for not remembering. You keep telling
Right.
yourself, he has dementia. And if they ask you the same question 100 times, you don't get mad at them. And I think that's how the world has to, you know, we have to start understanding where these people are coming from.
Right.
And if you understand and you're in a relationship, you have the choice to pull yourself away.
Of course.
But there's no reason to get angry at them, because if they're hurting, you yelling at them is not going to make it any better.
Right.
No.
And I teach my children the same thing. I'm
Yeah.
like, there's no, if somebody's an asshole, if somebody's a bully, if somebody is,
They're
you know,
hurting.
they have, there's something, they feel insecure or
Yeah.
they've had trauma, but doesn't still mean you need to stay with it. You can protect your own
Yes.
psyche, and you can say
Of
to myself,
course.
I send you love and light, and I have such empathy for you, but I am not. I mean, Taylor Swift just said that on. I loved what she said on this podcast recently, right before she got engaged. She said, you have to treat your energy as currency, and not everyone can afford it. You know,
Ooh,
not
I love
everyone
that.
gets to afford my energy, you know, because, and you get to choose who you spend your time with. So I think, you know, and we've all been in bad relationships, and we've all
Of
all
course.
had, and there's different reasons and different times, and there's a season for everything, and
Sure.
you learn more from those than you do. I'm a
Mhm.
much better wife to my second husband because I went through my first divorce. He's a much better husband
it's-
to me because he went through his first divorce, and
That's
we
what
have
my
so
husband
much.
says about
And
his
it's always
partner.
not between it could be your friend.
Could be a friend.
You
It could be
know?
a
It
sibling.
doesn't have to, yes.
And it could even, you know, I think that's why I love this. I loved this conversation so much, because I don't think there's anybody sitting here listening to this podcast right now that doesn't either have these feelings themselves, or have been in a relationship, or currently in a relationship in some capacity, whether it's a parent, whether it's, which is so hard if you deal with a parent that's a narcissist or has a borderline, because
Oh my
that
gosh.
starts the trauma. That's the generational trauma that happens. And how do you break that so that doesn't happen to your own children? I mean,
Yeah.
that's the thing as a mother that we all sort of strive to do as a parent in general, is how do we be better parents than our parents were? Even if you had the best parents, I had wonderful parents, but
Mhm.
no one comes out unscathed. No one. So, how do I have a few rapid fire questions for you
Okay.
from the end, which we're gonna give these, and then you've given us so much of your time, and I really appreciate it. What is the biggest myth about borderline personality disorder that you want to dispel?
That it is not treatable and that it cannot go into remission.
What is the most important DBT skill for emotion regulation?
The please skills, physical vulnerabilities, taking care of your physical vulnerabilities.
Explain that.
So, are you physically ill? Do you need to eat? Have you taken any mood altering substances? Have you slept? And did you exercise today?
Can personality disorders be cured? You've already answered this, but I want to hear it one more time.
Yes, with dialectical behavior therapy at SoCal DBT.
What's the best advice for somebody newly diagnosed with BPD?
Find dialectical behavior therapy at a real clinic that provides high fidelity dialectical behavior therapy that is given in the way that Marsha Linehan intended. So the evidence-based model.
We could fit so much more into this episode. And so I really want our listeners and our viewers to have access to some of these tools that you're talking about. How can everyone find you? How can somebody that doesn't live in Los Angeles, you know, or maybe couldn't afford to come see you, find out about all of these tools?
Sure. We're at SoCalDBT, so www.socaldbt.com. I also have a website at www.suzannewallach.com. And then on Instagram, we're at DBT Specialist LA.
Great.
And thank you so much for taking
you.
such good care of my patients. We have so many mutual patients.
Thank you so much.
Thank you. Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.